to Tub Talks with Damon on location in beautiful Denver, Colorado. And welcome to Season 5, the season premiere of Season 5 with leader, activist, educator, and general community inspiration, and someone I have loved for many, many years, Thera Marshall.
Thank you.
Welcome to Tub Talks. Welcome to the premiere of Season 5.
Thanks for having me. I feel honored in this moment.
I can't believe I've been doing this for 5 years now. It's kind of a trip.
I can believe it, and also I'm happy that you've done it. So
I'm so happy too. And when I started this, you were definitely on the list of people who were on my list of people I wanted to talk to in the tub.
That's very sweet.
Because you have been an inspiration to me, and the way you communicate ideas and concepts and celebration is an inspiration to me.
Sounds like me.
Yes, that is you. So I can't wait to talk about that and talk about your amazing work. But before I do that, I want to ask you, Thera, what do you like most about your body?
I like body parts in general. I say waist down.
Yeah.
I love it.
Yeah?
I love it. I love I have thick thighs,
Yeah.
a fat ass.
Yeah.
The penis is penising.
Yeah.
You know, the feet are pretty.
Yes.
So I love that portion, but there are definitely those moments in this world that I don't feel so great.
Okay.
Midsection, scar included. I had open heart surgery.
Okay.
So
Okay.
this is one of my little but we're working on it every day. We're working on it. But I love the lower half of my body. I like to show
So
it
it's
off.
both. It's both and.
Yeah.
There's parts of your body you can look at in the mirror and say, yeah, this feels good.
I think it's a
So
daily.
your penis? You feel good about your penis?
I love it. Yeah, it works.
I love hearing that. Yes.
Yeah, it works well.
Yes.
It's
And your
great.
thighs, your feet, your butt.
All that.
That's all really,
that.
really good
All
stuff.
that. And also, I find myself really attracted to men that are into like the lower half of my body.
Yeah.
Like, a man that says, "Hey, you got a fat ass." I'm like, "Yeah, I do for you."
Uh-huh.
Yeah.
Yeah, and I just want to make sure you speak up just a little bit.
Yeah,
because I want to
okay.
make sure everyone can hear
I'll make
everything,
sure.
all the good stuff you're saying.
Make sure of that.
Yes. Okay, so that feels good
Yeah.
when someone admires the parts of your body
For
that
sure.
you also admire.
For sure. For sure.
And that's a great thing. Do you ever, because what sometimes some men do is try to, like if for men who don't feel secure about their bodies or their penises, sometimes if a man does admire their penis or their ass, they try to disqualify them or discredit them in their mind.
Oh, yeah.
And I think that's a really slippery slope of self-esteem when people get into that whole, like, I'm not going to give credit to anyone who actually, I won't belong to a club that'll take me as a member kind of
For
thing.
sure.
You know?
Yeah, but a lot of times I think like the notions of bodies is like really irrelevant to outside sources because what you see like as the worst part of you, some people really find attractive and engaging.
Yeah.
And until someone lets you know, like, oh wow, I like that about you, you might not even hear it when they say that. But the truth is, people love a lot of things about bodies that necessarily you might not like.
Right. People and different people are drawn to different things.
For sure.
Like, so when, the things we celebrate or the things people try to diminish, it's like, even if you're not liking it, someone out there is.
A couple of people.
A couple.
Yeah.
Maybe a throuple.
Maybe.
Or more. Yeah. Maybe.
Yeah.
May I ask you more about the open heart surgery?
So 3 years ago, I suffered an aortic dissection, which is they call the widowmaker apparently. So when you have one, people die. And luckily, my best friend, his name is Christopher Marcus, I'd come home from eating dinner with one of my other friends at this place called Biker Gyms. And they serve like gourmet, fancy like hot dogs, right? I'm in love with hot dogs. And I came home and I didn't feel so well. And I was like, I don't feel so good. And I freaked out and I walked upstairs to my friend's room. Like, I don't feel so good. And he's like, oh, what's wrong with you? And I said, hey, can I just lay on your floor? And I'm not the type of person to lay on the floor. Just not. And he was like, Theory, what's wrong with you? Like, I'm taking you to the hospital. So luckily he took me to the hospital like in the early mornings, early minutes of the aortic dissection. And they whisked me into a hospital room, had some questions for me, and they set me in a wheelchair. They're like, oh, you can't walk anymore. I'm like, what do you mean I can't walk anymore? I was still so confused. I didn't even talk to a doctor. They put me in a room that was like the show ER. So it's like all these lights and people are running around and they're opening packages. And I'm like,
For you?
For me. But I had no idea. I didn't know what was going on because the doctor hadn't come in yet. So the nurses or no one can like tell me, hey, so you're having this because it's the doctor's me business. And I'm like, okay. So by the time I woke up, I had open heart surgery. My parents were called. My family was called. So unbeknownst to me, I'm alive today thanks God to my little best friend Chris Marcus and the doctors at Aurora Medical Center. But
Shout out to Chris and the doctors.
Yeah, it was a scary situation, and I'm only 48 years old, so I was 45 when this happened. And I'm a young buck, and I'm living life to the fullest and having a great time, and I had no idea. So I know we'll talk about this later, but I'm doing a lot of work when it comes to cardiac health, because a lot of people don't know this, but the LGBT community have higher risk than our straight counterparts of heart disease and cardiovascular issues.
Why? Or what?
Well, a lot of it is growing up stressed, being afraid. Fear really causes a lot of things, issues with the heart. Also, drug use and abuse will also help with that. We'll talk about poppers and things of that nature. So there's a lot of compounding factors when it comes to cardiovascular health in the queer community, because we just have a really, a worrisome life, and stress really affects the heart.
Wow.
Yeah.
Now, aortic dissection, am I saying that?
Yes.
Is that a heart attack?
It is. It's like basically your heart is like beating so fast, it's gonna explode. Pow. Yeah.
And had you ever had any warning or medical pre-warning that could happen?
I think I did, but I wasn't I'd wake up all with high blood pressure. Hypertension and high blood pressure are the main causes. And I come from a family historically that had high blood pressure, which I knew I had high blood pressure. But I think that on top of some of my drug uses and abuses could have also compounded that also. I wasn't on drugs at that time, but I think, weeks prior, months prior, years prior of engaging in drug use could have contributed to the aortic dissection, plus my hypertension through my lineage.
Okay,
it's
so
crazy.
There's family history of hypertension. What drugs were you using?
I was smoking weed, of course, and then I would do a little cocaine here and there. Yeah, and every once in a while some mushrooms maybe, but basically weed.
So with weed, is there a connection between that and aortic dissection?
Weed elevates your blood pressure.
Okay.
Yeah, so
I guess some people think of it as kind of medicinal the other way. They think it lowers their
definitely mentally chills you, but physically your heart is going at it.
Wow.
Yeah.
Okay.
Mm-hmm.
Were you scared?
As a matter of fact, I was not scared until I woke up. I thought oh, there you got heartburn. I thought at first it was I had indigestion or something, because I just ate a chili dog. A pheasant chili dog. So I was like, oh, I just got heartburn, girl. So I went in there, they literally gave me my Lanta. Is that what that stuff is? The white chalky.
Oh, yeah.
Yeah, I'm like, take this. And I was like, okay. And then they were doing an EKG and things of that nature. So I really wasn't worried. I just thought it was one of these episodes where you go to the doctor and they're like, all right, they're here, take these 3 pills and go home. And that was not the case.
And before you know it, they're swirling around you and the lights are going off.
Very much so. And I remember waking up in Aurora, and there was a lady sitting over me, and she's like, hey, Thera, we're going to take this tube out of your throat, because I was intubated. And I was like, who the hell are you? And I tried to fight her. Luckily, I was strapped to the bed, because I didn't know where I was, what was going on. I just come out of it all. And she was like, hey, Mr. Marshall, so we can either, you can let me do this, or you're going to have to keep this in your throat until... I'm like, I don't know what that means, but I don't want this in my mouth, because I couldn't talk or say anything. And so she's like, I'm gonna give you 10 minutes to think about this. And I came back. She came back and said, okay, it's gonna be real easy. Just relax, and I'll take it out. She took it out, and I couldn't even speak, but I just wanted to say thank you and what the fuck's going on. Yeah, I was like, what's going on? Where am I? Who are you? Why am I here? What happened to me?
How much time had gone by?
Yeah.
You didn't know.
I had no idea.
You just didn't know.
Yeah, it was less than 24 hours.
Ooh.
That was wild.
So what was it like to begin to understand medically what had just happened to you?
It's kind of devastating. I've always been an upbeat, jovial person, but it really put things in perspective about life and mortality and the way I was maneuvering in my life.
What did that do for you? What did that put into perspective?
It gave me a sense of just living my life to the fullest and no regrets. Because at the beginning I was really regretful. Okay, I can't believe you did this to yourself there or whatever. But
you were blaming yourself.
Very much so. And it just wasn't really healthy. But now I live in the idea that we're just gonna live this life there, and when they call us home, we're just gonna go home. There's nothing else I can do. I have people that have passed away before me that are younger than me that are seemingly healthier than me. And I have people that are born in their 90s, my grandparents, my great-grandparents, things of that nature. So Now I'm just living life and trying to do the best I can. So whenever the shit hits the fan, I leave a mark. And one good tell was when I did have this issue, my friends came out. They came out and showed support. They rallied around me. It was really, really amazing.
Wow.
So I know my worth in this world.
Did that reaffirm how
Very
much you matter to your friends
Very
in
much
this
so.
community?
And it's kind of weird because like a lot of people, like we love a lot of people, and a lot of people just don't know it. Because we don't walk around saying, I love you, you're amazing. Like, you know, some people are worried about their own bullshit or whatever the case may be, rightfully so, but we don't really have that connectivity situation until the shit hits the fan.
Yeah.
And I was in that moment, and now I know when I walk these streets of Denver that I'm making a real impact, that I should continue my work. It's very valid what I'm doing. My opinion is valid. Those around me that support me and collaborate with me validate that every single day. So I'm really excited just to be around to do this work and continue the work until it's over.
So it gives you a perspective, a deeper meaning and purpose to the life you have today, the work you're doing today, the service you offer
very much so
today.
It got a lot more meaningful because beforehand I was just doing fun. I was throwing parties and events and doing community, yay! And now it's like really personal that I'm really gonna try to make sure I actually save lives with intent.
Wow. What? So this was 3 years ago.
Yeah.
What was the recovery process like?
Ooh, I'm still recovering. Also in that I had 3 strokes, so I had some speech. I'm still working on the speech.
Okay.
Some speech issues, some mental blockage. So just day after day, year after year, just trying to read more and hone my skills a little bit better. The physical aspect, I'm like I can't do what I used to do, like physically walk 3 miles. I'm like I have to sit down.
Yeah.
I have to really take care. I'm older also, so I'm not a spring chicken, so rightfully so. It's just some physical aspects, and my body's changed a lot. Like I used to be a little slimmer, now I'm a little thicker, and life is good.
Okay.
Yeah.
Did you say 3 strokes?
Yeah.
Was that related to the aortic
Yeah.
issue? Okay. So were they around the same time?
They were during I think they believed during my surgery that I had those strokes. So they didn't find out until days after, because I was having some issues. Like, did you have any strokes? I'm like, I don't know. So they gave me MRI or CAT scan. CAT scan.
Mm-hmm.
No, an MRI. Is that the one where you get in the tube and they start screaming? I never had one. I think that's what it is. Well, that one. And I'm like, that one. But it was just weird. I'm like, a stroke? I had strokes? What the hell?
So it wasn't until after the fact that you found out you had 3 strokes during this surgical procedure. Okay.
Yeah.
What was that like to get that
It's
information?
weird. It's just weird. Like when you get any kind of information like that, hey, you have cancer. It's just like, whoa, what the hell?
Yeah.
Because you feel like you know your body.
Yeah.
Like the aches and pains. You know what feels good, what feels bad. But then when something internally happens, and you're like, what?
Yeah.
How? Is this me?
When did you get diagnosed with cancer?
I did not.
Oh, okay.
No, I was like when you.
Oh, you said when one does.
When one gets diagnosed, you're like, you just go into those tailspin like, what's going on with my body?
Okay.
When you don't understand that it's just how the body works.
Right. The body is doing what the body does.
Yeah, and you can do all the things to negate those things. Work out, eat healthy, all that. And if it's coming for you, it's just gonna come for you. And it's weird.
Wow.
It's a weird feeling.
So then what did the recovery process look like? Have you had physical therapy?
I had.
Have they offered you mental health therapy?
No, but luckily I have great insurance with my organization, so I can have counselors. I also have counselors on staff that we can have conversations with. So I am really blessed in that notion. But physically, I went through cardiac rehab, which was like weight training, like walking on the treadmill, just building my heart up so I can sustain life. I had to relearn to walk. I couldn't walk.
Wow.
Yeah, so I was like wheelchair bound, scooter bound.
Was that because of the strokes that walking?
Yeah, very much so.
Had to be
it was a problem. It was wild.
Okay.
It's a wild situation.
Okay. And you said 3 years later you were in that process now.
Yeah. I think it's every day's a struggle. So I don't think I'll ever fully recover from an open heart surgery. I don't think anyone ever really fully recovers.
Mm-hmm.
But you just take it day by day and you do the best you can and have fun in the process. Yeah.
Are drugs still a part of your life?
Yeah. I'll do some drugs. Why not?
Okay.
Yeah, as I say, life is about living it. And if I'm in a situation and I feel good and comfortable and I feel safe, I will. Now, will I buy a whole kilo of cocaine and hang out for the next 3 days? No. But I'll do a bump in the bathroom with you, and let's go party on the dance floor.
Okay, after this, we're not going to do that right now.
He's lying.
Do you ever worry about this happening again? Do you ever find your heart beating and thinking, oh shit, it's going on again?
Well, I have those episodes all the time because it's ebbs and flows. I still suffer from hypertension. I take like 10 pills a day. Mm-hmm. It's so annoying. But like, once again, when it happens, it's going to happen. I've told my mother, my father, I love them, my brother, I love them. They know that my love is there, and I literally can walk out here today and get hit by a car, and it's over. So I'm not really going to hold on to things like that. Being scared right now of death is something I'm not really a part of. Mm-hmm. And when it happens, it's going to happen. In the moment, who knows?
Have you had any incidents where you felt heartburn or heart acceleration and thought, oh no, this could be happening again?
Yes, of course. Yeah. Like especially when I'm in situations like of high anxiety or nervousness or whatever, and I'm like, oh my gosh, Thera, slow you down.
What do you do to get through that?
It's like just breathe and like come back to earth, because a lot of times it's really mental. It's really mental, me like thinking, overthinking, or worried about something. Like last night was a stressful event for me here in Denver at this function that we threw, and I just wanted to be perfect, and I want things to happen right. So it's a stressor, and when things don't go right, add on that stressor, and then sometimes like, Thera, sit down. Sit down. Actually, my boss said, Thera, sit down. Because I'm running left and right and picking up this and doing that. And sometimes I need that call out, like, hey, Thera, like, you can't do it all. Sit down. So that's what I just try to do, is sit down and relax.
Wow.
Yeah.
Did you have to change your food diet in any way?
I have, yeah. Yeah, I eat more of like a Mediterranean cooler diet, but I do love a good cheeseburger with bacon. Mm-hmm. So it's, once again, ebbs and flows, and, you know, do as best as I can.
Yeah.
Yeah.
Did it change your sexual practice?
You know what? At the beginning, I was so pissed because I didn't know if I could have sex. I was like, girl, I don't want to blow my heart up, but now I'm good. We're good now.
How did you learn to be able to have sex and trust your heart would
I think I just jumped in and I was like, I didn't die. Really, I was so afraid.
Did the doctors give you any adequate medical guidance about how to have sex after open heart surgery?
There was no specific medical guidance, and I think also just because the medical field are not really engaged in sexual health and history and pleasure and things of that nature. They just really aren't. And I remember asking my doctor, Dr. Finster, I was like, oh, so is it okay if I have sex? He's like, well, if you feel like you can, yeah. So it's more like that was a great thing to say, but he didn't go into detail, you know. And I was like, okay, cool. Well, if I feel good, I'll just go for it.
Wow.
Yeah.
As a result of your experience, do you feel like other people have have learned about their own risk factors and perhaps been more proactive in terms of understanding or talking to their providers about their individual risk factors for cardiac disease?
If not, they will. Because I told you, I started this new Black and Brown LGBTQIA queer collective, focuses on health, with cardiovascular health being a part of that.
Okay.
Also, when it comes to HIV prevention and treatment and mental health in the queer community. And the goal is just to let people know, because a lot of people don't know that when it comes to being LGBTQIA, that we are at higher risk of heart disease and heart failure and those kind of catastrophic.
I really didn't know that. This is news to me, because I understand genetic factors and intergenerational trauma and our own family things. I didn't really know that this community predisposed us to some of these higher risks.
Well, you got to think about it. We're queer and we're on the outskirts or marginalized, and then we have like these expectations to live up with our families and to be straight, and that's a worrisome world. If you're always in a place of trying to diminish who you are so people won't really know who you are. You're worried about someone finds out, or you have a boyfriend and they find out, or whatever they find out, whatever that is. That worry right there compounds all the other things you're doing. Drug usage will hit you with that. Popper usage is really dangerous. I used to do some poppers back in the day, right? And I walked in with this shirt, that shirt right there. I was like, do I need to get one of those round circles with a cross on it? Because I'm not anti-poppers. I just know they're not good for you at all.
What are the dangers and risks?
Well, they just once again they just elevate the heart to a place that it should not be. That's why like you're captivated in the heart, and that's why you're open up. Everything is focused on the heart at that point. So the blood can't flow to the booty hole.
Right.
So you're just all like, I feel good, and you're all lightheaded. That lightheadedness, that's not good. So it really
it's not healthy for us. It might feel good.
No, it does feel
but
great.
It's not healthy.
That's it, not healthy at all.
And contributes now, you're saying, contributes to heart risk.
Very much so.
Okay.
Mm-hmm.
That's good for me. I mean,
and I don't ever want to yuck someone's yum, but I just want people to know that, while you're out there doing this and you're having fun.
You were the last person on earth
who
yucks people's
some
yucks.
people might feel that way,
Well,
but if you like poppers, do you, boo. But just know that there are a high risk of some engagement when it comes to your cardiovascular health.
Right. So let's talk about the collective, because I've always seen you as a leader and someone who's able to give adequate, helpful harm reduction strategies.
Love it.
Right? Not a moralistic thing, just like helpful things about poppers and drugs and like what you do or what you don't want to do together, or, the collective you started.
Well, this is actually started by my organization, or partnered with my organization, funded by the Colorado Health Foundation.
Okay.
And basically our goal is for Black and brown people. I think there's a total of 16 of us. And I chair it with the side of my friend Vanilla P. Santamaria, who's a Latin trans woman. And our goal is really just to get out of the community and throw some fun events. We want to entertain and educate and inform. And that's our only mission. That's really to bring you to a place, have a great time, and put some tidbits of knowledge into your head, give you some information that you can go home with, that you can actually utilize and put into your real lives day to day. So we're not asking you to do too much. Just learn a little bit something, and maybe you can pass that knowledge on to other people as a community. And we really focus on Black and brown bodies. Yeah. So I'm really happy about it. And also I love the aspect of it because Colorado Health Foundation has fortified our little group by the means that we can pay those Black and brown bodies, these trans women, cash money for coming into a meeting and building up our organization. Because I don't know what everyone else sees, but I see this organization becoming a 501c, our own personal nonprofit organization or community-based organization all by ourselves. And now we're funded by someone else, so we'll see where this goes. But I'm really excited about the work we're doing. We're throwing a trans symposium here in Denver on August 9th at the Lowry Conference Center. Registration, I believe, will happen sometime soon. But I'm just really excited about having Black and brown people around me, like doing great things, so we can have great things.
So, and this is It Takes a Village?
Yeah, It Takes a Village is the purveyor of it, but the Black and Brown Collective is its own thing.
Okay.
Yeah.
Does it have its own name, or is it?
Yeah, it's the Black and Brown LGBTQIA Health Collective.
Okay.
And you can find us on Instagram too.
Great. So that link will be down below.
Yes.
So I wish I could have been there last night.
Yeah.
Thanks to, I don't want to blame Delta, but thanks to weather issues.
Oh, yeah.
I got here like 5 hours later so I couldn't go. But last night you produced an event just down the street.
It's called the Enchanted Ball at a restaurant called the Champagne Tiger. And Champagne Tiger, I would say, is a queer-owned and operated piano bar. They have drag queen brunches and dinners and lunches, but they also have a patio that is like enchanting. It's beautiful back there. It's a vibe. Wow. It's beautiful. The food is amazing too, and the service staff, they're fun, they're queer, they're weird. It's just a really good place to be. So last night we went there, we threw the Enchanted Ball. So it was a ballroom. We had our trans ladies out there. We had some flipping and dipping and some ducking, and then it was all kinds of cool. I'm old and I don't have good knees. These kids' knees, they were doing so many like crazy things like with their bodies.
So competing?
Yeah. Well, a ball, like the history of a ball. Yeah. So we had $4,000 cash on the floor. So if you win the category, there's some money going home to you and your family.
So they were competing for real.
They were real. It was a real ball. Like there was like almost 300 people there.
Wow.
It was wild. So I'm really happy.
So 300 people showed up.
Yeah.
And so not only did they hopefully have a good time.
They did.
And you said there was education, information.
Very much so.
What kind of education information?
Well, once again, like we're having a campaign for the collective called "What's the T," and it's just really about giving information about cardiovascular health and about HIV treatment and prevention and about mental health. And basically, we will continue to put out more information. I don't like to bombard people with a lot of information right now. I give you one hot topic point, and let's keep it pushing. Let's have a good time. So
last night was it the focus cardiac health?
Well, we talked about cardiac health. We usually give like 1 point for each engagement. So mental health, HIV, and cardiovascular health. So we just throw something out there and let you all know, give you a little tidbit, and ask you to follow us, because then we do little vignettes on our Facebook page and our Instagram that will give you some tidbits of information there. So it's not locking you, loading you down with a bunch of stuff. I don't want to put you in a classroom, get you pen and paper. I'm not into that kind of education.
Yeah. But I think a lot of people, in general, especially younger people, don't really think about cardiac health in a proactive way.
No one does. I didn't until I had to. And I don't want people to have to think about it to actually understand what's going on in their body internally. Because once again, you don't know this stuff is going on until you go to the doctor. And a lot of people, young people, part of my problem was I was young. So I was like, I don't know if to go to the doctor. I have great insurance and I wasn't going to the doctor. And I said, if you have insurance, use that. Take those wellness checks, like engage in those things. Find a doctor that you can actually talk about things that necessarily he would never or she would never talk about in those moments. So, and I think also asking arbitrary questions that have nothing to really do with your health at that moment are always cool. Like if you have some issues that you just want to know about, ask a professional in that moment of time. And that may not, once again, have anything to do with your health.
Right.
And what you're looking for.
And so one of the things that I was hoping would happen, which to some degree happens for some folks, is with PrEP. And with U equals U as HIV treatment and prevention, that these would be what we call gateway drugs to have these other conversations. That once you have a relationship with a provider and you trust that person, that could lead to other positive health outcomes like monitoring your cholesterol, your blood pressure, your cardiac health, all the heart, your risk for heart attacks, all the things that we want to think about proactively if we can as we get older. And sometimes the gateway through that is sexual health or HIV prevention.
For sure.
So is that something that the collective helps? It's like, well, if you start to go somewhere for PrEP or you start to go somewhere for treatment, it could also lead to these deeper conversations.
For sure. And also when you think about when you have to have that advocacy portion. A lot of people go to the doctor and they have no idea how to advocate for their own personal health. So we really want to talk, especially when it comes to black and brown bodies.
Yes.
I want them to know, we have to ask these questions.
So what do you teach? What do you want people to know?
Well, I want people to know that doctors and medical professionals are just that, they're professional. Doesn't mean they're worldly, they don't have life experiences, they don't have cultural life experiences. And we, as the patient, have to teach them those things or push them to find out about those things. Mm-hmm. So when I think about advocacy for my own personal health, when I have an issue, I want to tell my doctor, so I've been thinking about this, and I want to know your take on it, and is it something I should be worrying about? It's just asking questions. And a lot of times people get to the doctor and they feel this doctor's a source of authority. And you don't ask questions to authority. But I'm like, we pay for you, boo. I'm like, my money's going in your pocket. And I just have to flip that narrative where you might be a professional, but this is my body, this is my money, this is my choice. So you're going to tell me some answers to these questions that I have.
Yes.
So it's really that kind of idea of being able to flip the script and have the mentality of these are professionals and they are smart and all that, but you're just as smart, you're just as worthy. And once again,
say that again. I want people to hear this
part. You're
just
as smart and you're just as worthy, and without your money, they would not be them. So if you spend your hard-earned money, your insurance bucks, you get to ask those questions with a chip on your shoulder and expect the answers right. And if not, we've got to move on to another provider.
Yes.
Because I feel like that's what it is. People really need to find out health advocacy is going to change the world. And a lot of people just don't advocate for themselves.
Right. And a lot of people don't know how to. And it sounds like you're showing people this is the mentality, what I call the consumer mentality to healthcare, not the patient.
Yeah.
Patient is that thing that you describe where you sit down, you shut up, you don't ask questions, and you certainly don't talk about fucking in a joyful way.
Very much so.
In the consumer model, we go in with that mentality. This is a person with a professional perspective, but we are the advocates.
We're paying for the good.
We're paying for it.
That's it, So I'm hopeful that people can really step up in those moments because you'll learn a lot more. I really wish that I would have asked more questions and also went to the doctor more. As I said, going to the doctor is going to be your first step. Yes. And then advocating for yourself in those appointments are just going to be the second step. But it's going to the doctor first.
What are the questions you wished you would have asked before your cardiac event?
I wish I would have been honest a lot of times. Because I would have these little dizzy spells. As I said, I felt like things were going on, but nothing I was gonna have a heart attack, nothing like that. But I really wish I would have been I've been dizzy here and there, what's that about? What do you think that is? So he could at least been like, well, you know, you got high blood pressure. It's not good for this, that, and the other, but I wasn't going to the doctor.
And what held you back from going to the doctor when you were having dizzy spells?
The next day, feeling okay. It passed.
So once it passed, you were like, all right,
back to normal. Okay. No issue. Yeah. And that's not what you should. Yeah.
So you're helping Black and brown people say, when you feel something, if you see something, say something.
Pretty much.
You know, like, don't hesitate.
Very much so. And I feel like sometimes it's a pride thing in a lot of ways, especially when it comes to Black and brown people. Like, we don't need help in some aspects. In some families, you know, we don't. We got this. And
so then asking for help would be a sign of
weakness.
Vulnerability.
Vulnerability would be nice, but I think more weakness is more a pointed term that I like. It's like, I'm weak and I can't handle my business or my shit. And I don't believe that's the case. I think it's really, the vulnerable part is beautiful. Like, I wish they would be vulnerable or be afraid to be vulnerable, because then now that we know that there's some mental health issues in there about being vulnerable, but being weak is like really a pointed term that people aren't weak. People may have some indiscretion to be vulnerable, but not weak.
Right.
Yeah.
I think also just, you know, the cultural history of being shamed and stigmatized for being a person of color and or being in a sexual minority in this country. It's like, there's a history behind that.
For sure.
It's not like we just got that from nowhere. It's like, you know, that idea of like, you know, hey, I got high and got fucked last night and I'm dizzy today. Most of us feel like we can't say that to a medical professional without being shamed or stigmatized.
That's why we gotta advocate for ourselves. We should be saying those things. We should be saying those things directly to them. And then when they act shocked, call them out on that. Yeah. Like, you seem shocked. Have you never had a discussion like this? Because then you challenge their professionalism. Like, as a professional, you should be having these conversations with your patients. Yeah. Doctor, sir, ma'am.
Are there culturally competent services available in Denver in terms of people of color in working in medicine, or people who are sexually experienced?
I would say yes, but you have to find them directly. And
how do they do that?
Well, one way is come through It Takes a Village. If you're looking for some sexual health engagement as a Black or brown person, or marginalized, trans, whatever, It Takes a Village. We have a great group of individuals that are culturally competent first and foremost, and can navigate you through systems that are culturally competent and focus on Black and brown bodies. So we do a lot of work with UCH and
what's UCH?
University of Colorado Hospital. But they the Anschutz campus, but they have an infectious disease group, and Kendra Dixon and Sarah Smith, who are their prep coordinators, they have a direct contact with our organization. So when we do some prep navigation into their system, they are prepared and they're knowledgeable, and these are white women. Mm-hmm. So it doesn't have to really be that Black on Black, brown on brown. We just have to have someone that, like, when they see you, they see you. Mm-hmm. You know, when you walk in the door, they're prepared for whatever you have, and there's no judgment. So I found that you just have to find those organizations out there that are not only doing the work internally, but have those external partners and collaborators that are going to continue to push their work forward. And I think that's what it is. As you, as a person that has been in the nonprofit world for the past 15, 20 years, like, having those hot handoffs, and I don't mean warm is like, yeah, you're gonna see Sarah over there, and then we literally put you in the car, drive your ass over there, walk you 7 flights of stairs to the office, put you in a room, let you know, are you cool? We'll be out here later to pick you up. So we just really want to give that kind of engagement, and also it just allows them the ability to recognize that, oh, I could have did this myself. You don't need my big black ass next to you. You're like, oh, I feel so stupid that I had you come here, hang out for an hour when I just walked in there, and that was such an easy process. So we do that.
But with It Takes a Village, you do that. You do the hot handoff. You bring somebody. Yeah. If they want that level of support,
we ask you.
You will go with them.
Yeah.
God, that's amazing.
Yeah. No, I'm really thankful for the work that Imani Latif has put out there. And allowed us to do. And she's really good at allowing me to do what I want to do. I'm like, I want to do this. She's like, okay, we can do that.
Right.
And so just having that freedom to really engage community like others can't or won't is always great.
Yeah. Again, as I think it's generous of you to share your experiences.
Yeah.
Do you feel like by doing that, you're someone who goes to a meeting, or a black or brown person, is more likely to be inspired to take better care of themselves when they hear what you've been through, and when you talk about ways that you are learning to advocate for yourself now.
I hope so. I really don't know. I don't.
Have you gotten that feedback at all?
No.
Okay.
Not necessarily, but once again, people don't really share things like
Right.
that until I die. Like literally, there's gonna be those notes out there. I remember when I talked to you at the club, and you really inspired me. Which is
If only there was Facebook in heaven.
Yeah.
And then you could see all those wonderful things you did in your lifetime,
Right,
and
but-
people will tell you about till they're on Facebook in heaven.
I still think that's beautiful. Like I don't do this work because I want someone to be like, oh, you're amazing there. I don't need that. My mom and dad didn't tell me enough, and I believe them more than anyone else. But it is one of those situations where, like, I know that I'm making some type of impact, because I would walk in a room and people are like, oh, that's there. And that notion itself says that I'm doing something. Now, do I know that I've really affected someone in a positive way? I have not had that story yet. I'm looking forward. So if you're out there, come on by.
Okay.
Yeah.
Okay. Well, as I think, again, as you said, people are less likely to offer that feedback, that data, on an everyday basis. It's just not something we often do in this culture, is go back to the mentors or the educators and say, oh, I think I didn't have a heart attack this year, and you were partly to thanks for me being proactive and talking to somebody.
A lot of times it's also connecting the dots.
Yeah.
Like maybe you've heard something and you picked it up and it's engaged in an institute in your life, and after years, like, you don't know where it came from.
Yeah.
You have no idea.
Right.
Like, why do I do this now?
Right.
And it may be just like a point that someone has put into your mind, and you're like, oh, and you just grabbed onto it. So there's no real linkage to me.
Right.
So I'm okay with that. I just want people to be healthy, safe, and be...
Not everybody does a bathtub show where they thank their heroes and their idols.
Right.
I do it, but not everybody
No,
does.
that's true.
So,
I love that.
But I know, like, for me, your spirit, your energy, and in this community, you have been and continue to be such a beacon of light and education and inspiration. So I know that, whether you're hearing it directly or not. Back to It Takes a Village, and so sexual health is talked about. Like PrEP, U equals U. Do you feel like now in 2025 people have a better understanding of these concepts than they did 5-10 years ago? So what's going on with that?
No, they don't. Like, I have so many clients that come through to get tested, and we have a standard operating procedure. If you come in, you get tested, and we talk about, like, oh, do you know about PrEP? And literally I say 70% of the time people are like, no.
Really?
Yeah.
Okay.
I think PrEP is definitely one of those things you must be engaged, like, in PrEP in some way. You must be gay, especially our straight counterparts, especially women, have no idea about PrEP. And we've been doing this for years.
Yeah.
Right?
So the thing that I thought, and naively, is like once the commercials started happening, for better or for worse, the pharmaceutical companies started making these commercials and airing them during RuPaul's Drag Race and airing them during the Rachel Maddow show and various programs. Even during the Grammy Awards, there was like a PrEP advertisement. I thought that would at least help get that somewhere in somebody's brain. You're saying that's not really working that way?
I think it might be working, but not on the scale that we need it to be working. Yeah. Of course, there's people that see those commercials and go, oh, wow. But I feel like sometimes those commercials are, it's another pill. And like, I'm
like every commercial is now, it's for like a pill.
They're all Yagovi, whatever that is.
Yeah.
It's just that. But, and also I feel like there are commercials, I feel there's definitely a way that engaging in PrEP can be a little bit more dynamic, and I don't know what that is, but a commercial's not really gonna do it. What I do like about some of those commercials that I do see black and brown bodies in them, but yeah, I don't think they're really moving the needle that much. And I feel like it's just really about the community educating individuals. It's your neighbors telling you these things. Our neighbors tell us so much bullshit, right? That we need to have these conversations about real shit.
Yeah.
When it comes to life, they're really good to talk shit about the neighbor, this, doing that, and the other. But did you hear about this new injectable PrEP?
Yeah.
It's too. Have you heard about it? Like that's what the conversation we need to really have. But people are just in their Americanized worlds,
And do you feel like the message about U equals you, for those who don't know, season 5 premiere, it's U equals you, the science that tells us without a shadow of a doubt that someone living with HIV cannot transmit HIV while they're in treatment and while they have a suppressed viral load. Is that message getting out in this circle?
No.
Okay.
Unfortunately, because we're in a post-scientific world, as we see right now. So even if you show them the science, you show them the data, like, first and foremost, Americans don't read. So you have to couple that up with me telling you this and you believing it.
Yeah.
Right? So I think there's just a lot of barriers that we have, but what we can do is try to reach those individuals that want to listen. And that's where I'm at. I'm at the point where I would love for the numbers to go down drastically, but my point is now, I'm in this community right now. And if I can educate and help one person, 2 people, 3 people, I've really done my job.
Yeah.
Right? Now, would I love for the world and the nation to like about face and like understand like what's really going on and listen to the data and propel these notions and ideas forward? Yeah, but the reality is I just can only do so much.
Right.
And I can't be stressing myself out and trying to do more than I can.
Sure.
But that's just where I'm standing.
And I think what you're speaking to is that if we're going to change hearts and minds, it has to be on that community level. It's not going to come from a pharmaceutical commercial on the show. It's got to be from a leader, a community, from regular conversations, which sounds like what the collective is offering. Yeah. And it takes a village is putting out there for folks to normalize this message.
Very much
and so that they'll hear it enough that maybe it'll get in there somewhere.
I agree.
Does anybody, you feel like, understand DoxyPEP, the impact and potential of doxycycline to prevent STIs on a community level?
They do, yeah, but again, it's about community engagement. They're not watching the commercial. They're not reading.
Well, we don't have commercials for that.
They're not reading the information. They're not reading they're just not reading. So it has to be engaged in a personal, one-on-one way.
Yeah.
To talk about those benefits for DoxyPEP. Like this is not how we.
What you're doing
right now. That's what I'm saying. I do what I can because I can show you some articles. Yeah. But you're not gonna read them. Not you specifically, but like they're just not. And I hate it because I'm a reader of things, and I'm like, I like to gain knowledge that way, so I can like also gain language and verbiage, so I can use it on people. Like, oh yeah, well, did you know that? I want to do that, so I want to be knowledgeable in that capacity. But Americans are not those kind of people. They want the commercial. They want the flash and the bang, but I also know they want the person-to-person contact and engagement. And that's what I really focus on, is how we get people in a space and get them informed and entertained and educated.
Yeah. So here in Denver, how are you going to know when that message is getting through, or how are you going to know when you're having an impact?
Well, I think people showing up to things that we throw. Just people showing up in general means you're doing something right. And then once again, you put that information out when people show up and they take it or they leave it.
Yeah, I mean, last night was 300.
Very much so.
So like, that's huge.
It's huge. So even though I know all 300 were not here to listen to me give my little spiel, I know there were some that were in front of me that were like listening intently, and those are the ones, because there are always going to be people in the background having their conversations, that are having their fun or still engaging in the party. But there were literally people right in front, like sitting there looking at me as I'm talking about heart health, as I'm talking about HIV and STIs and prevention and treatment. So I know there were a few people out there that was like, okay, thanks, and kept it pushing after that.
Right, yeah. And you just never know where in their decision-making tree you're going to land in that.
You can't make anyone do anything, but you just hope that that you spark some type of interest.
Something I have loved about the energy around your work, as long as I've known you, and since I've seen you do this in social media, is that there remains a resilient kind of joy and celebration among the education you provide.
Yeah.
How do you do that? How do you keep that going?
I'm my mother's child. My mother is an educator. She has been teaching since she was 22. My mother is now 74. She's still at New Mexico Junior College right now, on faculty. And we're just educators. I have an aunt who is the administrator in Lubbock, Texas. I just come from educators that are joyful people that love to educate, to love to spread knowledge, that when they learn something, they want you to know it too. You know, because there's isolations out there when it comes to education. Some people are elitist, and I want to know this. I'm the smartest in the room, and sometimes I tell people I'm the smartest in the room, but I don't care. I really don't. Like, you know, I feel it's good to be that way, where there's people that have something about them that goes beyond their knowledge. And I feel like I come from educators that my parents are very charismatic, my aunts and uncles are very charismatic, like successful people, but they are just lovers. And they could be high sedity and all bougie, but they're just country folks that got a brain in them.
Yeah.
You know, and love to like tell stories and make things happen and help individuals and elevate those around us. Because we know one thing, when your neighbor is happy and healthy, well fed, monetary, like sufficient, they're not really worried about what y'all are doing. And you're also happy, hungry, fed, and self-sufficient. So I just think about always trying to elevate and push people up to where I'm at. And I want those people to help me and push me up to where they're at. I think that's just how we all lift each other up. And at some point, life will be more equitable and more engaged. And people like each other a little bit more. We just are such haters in America as humans in general. And I'm just really into liking people.
I love that. Yeah. You say, I'm really into liking people.
I am.
You know, especially in our current administration, there's so many responses to that on the left. And there's so many ways that I see people resisting and protesting. Yeah. Some of which are very much in this notion of that we must be miserable and we must be depressed and we must attack each other, and you know, we can't actually laugh or smile or have any joy while we're fighting back. I know that's not your thing, that's not my thing. No. But it seems to be, and this reminded me, I mean, it was this is not unique to Trump, this was like 80s and 90s during the AIDS crisis, that there were those who just were resolved to be defiant in their misery and anger in attacks with each other. And those of us who are like, I'm a lover, not a fighter, and we can fight and love at the same time.
You can. Oh God.
You know, and I've always thought that like, that's your, you know, how you present that.
Yeah. A really good fight. And be a lover.
Yes.
Because I'm no punk.
Yeah.
I'm no punk. I'm no pushover. I'm nobody's bitch. But what I know is I know how to love, and I know how to fight, and I know my worth. I know my community's worth. So I'm always gonna be a lover. But don't cross me. I'm not here to play with you, little boy. I'm just not. But I'm definitely a lover. I want happiness. I hate people that are miserable. That's sad. You know, you got so much going for you over here, man. That's weird. Yeah. That's so weird. So, as you said, like, we can love and we can fight. Yes. And I think that's really the point.
Love it.
You're awesome.
That's dope. Oh, so good. Last question, or almost last question. Like, what, if anything, is giving you a sense of hope today?
I guess not to be this person, but my ancestors. We've done this before. They probably did it better than us. You know, just like my grandparents, you know, grew up in the South, and they dealt with so much shit, from Plattsburgh, Arkansas to Tallahassee, Florida. They were not in like the greatest places, and they raised beautiful families that would educate children, and they did the best they could with what they had. And modern day, I thank them so much for being so strong, because I would not have the life I have today. I would not be the man I am today. I would not, my country ass grandparents had this gay ass little grandson, and they would never think this was what their grandson would be. But I feel like they are speaking through me all the time, every day, and I feel really passionate about the things I do because my grandparents were really passionate, and I take them with me. So I feel like I'm gonna be all right in this situation. I just hope that people are along the ride with me, that we're gonna be all right, because our ancestors have done this, once again, a lot worse. A lot worse, a lot less protections, you know? Like, we can own a gun at some point. I got a couple. Come to my house. You don't want to come in here like this. So, like, I feel, like, real protected. I feel like I also know that I can utilize all the rights that are given to me just like any other white person. And I feel like that's what I want to tell our marginalized community. Like, you are just like those white folks. They'll tell you everything that's not right about you, but the truth is the Constitution is real, and it's still in effect today. It's still in effect. We might not have it very long, but it's still in effect today. So we need to be ready and studied up and prepared, and don't take the bullshit. Just know that our ancestors have done this in a very, very I would say, nice way. Because one thing we know, if Black and brown people wanted to fucking act a fucking fool, we have every right and intention. I think we're just so graceful and we're so forgiving to our past 400 years. Think about this, 400 years of being diminished, right? And all you want to do is like, just be equal, modern day. And you still can't get that. At some point, it's gonna snap. And as my grandma said, niggas will nigga. And that's a weird term to say, but they want to see that. We can show them that, but I don't think that's the way to go. It's not. It sounds very militant. It sounds very scary. But when you're pushed up against the wall, what else you have to do? Fight your way out, and that's unfortunate. So I hope that we can get over this. Hope that the administration finds some clarity, and I mean through death. And I think that's what we're gonna have to happen. I always think that in America right now, the best things are gonna happen is when old people die, and young people that don't want to be like them or listen to them come up, and that's the only way America's gonna change.
Beautiful, beautiful. No, I mean it's really important. Thank you.
Yeah, thank you.
Thank you for that.
Yeah, thank you.
I want to hear that. This is important, and the 400 years of being shit on and put down politically, and that's all that's being asked for today is equality, equity, diversity, and they still have to put their foot down on that. Like they can't hold that.
It's weird.
Yeah.
It's weird.
Do you get angry about this?
Of course.
Yeah.
I'm more sad than angry, like I'm more like disappointed because I believe in the American dream. I have a beautiful family, a beautiful life because of America, but to have nice things and still be shit on, to do good work, still be shit on, to live the American way and be shit on, it sounds like a farce, and always the goalposts always been moved. It's really sad. Like, it makes me sad. Stupid people make me sad. Like, when you're stupid, I'm sad for you. You can't get this concept. I'm sad for you. I'm not mad at you. I'm really sad. I'm disappointed that you can't grasp onto this idea. Yeah, so I feel that way.
You're so amazing. Thank you so much for taking time for this. Is there anything I haven't asked you that you want to make sure we cover, or that the Bathtub audience, season 5, knows about you and your work or your message?
No, let's see. Not really. Just like go out there and be good, like and take the bulls by the horn, and like don't let nobody shit on you.
Yeah.
And love your community. Yeah.
Beautiful.
Yeah.
All right, people want to keep following your work, your message, your joy, your...
Sweet. I'm like, put it down there. I don't know my handle because I'm bad.
Okay.
My name Thera Marshall.
Okay, on Instagram?
Yeah.
Or...
No, that's Dip Jr.
Okay.
Yeah, this is my dad's nickname.
Oh.
And I'm the third.
Dip Jr.?
I call his name, they call him Dip.
Oh, okay.
That he got because his name is Thera.
Okay.
And the joke, he was diphtheria. The disease.
Oh shit.
Yeah. So,
oh my gosh.
And I'm Dip Jr.
Dip Jr. Okay.
Yeah, Dip Jr. on Instagram, and then Thera Marshall on other socials.
And if people want to see It Takes a Village and support that or make donations,
yes, go to It Takes a Village. co.org. We have a donation situation there.
Great.
And look for us also on Instagram with our Black and Brown Collective, which is down below also for upcoming events.
Beautiful.
Thanks so much.
Thank you. And thank you all for watching. This is the 201st episode now. So we're in the first 200, in the beginning. And I couldn't think of a better guest to begin this part of this series with.
I wish you nothing but the best in this journey. And also, I hope that your flights are going to be good going home and so you get bed and all this stuff. But yeah, thank you so much, Damon, and all the work you do, because you are a really prolific individual, and I feel really honored. And I appreciate you.
I appreciate you. All right, everybody. So if you like this series, subscribe, because yes, there are 4 other seasons ahead of this one where we're learning about ways that we can celebrate education, information, inspiration, have better sex, and I think just try to be decent human beings, for fuck's sake.
Amen.
So subscribe down below to get that information. And please, if anything here sparked interest in you, think about what it might be like to have these conversations with your friends, in your bathtubs, at your pools, your brunch tables, wherever you have conversations with your friend, naked or otherwise. Talk about these issues that matter. Thank you, Thera. Love you.
Thank you.
Mwah. Thanks, everybody.